So recently, together with colleagues from all over the world, mostly movement disorder specialists, we propose this clinical criteria for research purposes at the moment, but that we think are important for classifying Parkinson's disease. So the idea is that if we are able to distinguish different types of Parkinson's disease, we will be able to select patients better for clinical trials, for interventions that may be applicable for some patients but not for others. So this is the goal. And how do we do that? So we think that now, given the progress in this biomarker field with the seed amplification assay, that will be one level of information that we can obtain. We can measure whether patients have this positive signal or negative signal. And we know that there's people with a clinical diagnosis that show both. So now we have a tool to distinguish between these two different types of people that have a positive or negative signal in this assay. On the other hand, another level is the neurodegeneration. And this can be measured with a DAT scan or DAT SPECT, so we can detect whether there is already signs of degeneration of dopaminergic neurons in the brain or not. There's other types of imaging like MIBG that measures the innervation of the heart that is also valuable in the field, and this can also be used as a complementary imaging technique to measure degeneration of other types of neurons, but that are important in the field of Parkinson's as well. And finally, genetics. Genetics has been around for a long time. We've been able to measure genetic alterations in patients for quite some time, and this is another level that we think is important. If we can identify genetic factors that are associated with familial forms that cause disease, or other factors that are just predisposition factors, then we can also distinguish these types of people with different factors that we will then be able to also select for different trials and different interventions. And of course, all of these, the synuclein, the neurodegeneration, and the genetics, they form the basis of the criteria that we call the SynNeurGe criteria. These need to be always looked at together from the eyes of a movement disorder specialist. So the clinician, the clinical aspect is also very important. And there, again, we may find people that already have the clinical manifestation of the motor features or not. And this is going to be important, again, to distinguish people and to define at what stage they are, if they are already in the motor stage of disease or in the premotor stage. So that's the basis of the criteria. So how this criteria will be used at the moment is not based on a scoring system. It's based on simple positive versus negative. So synuclein, is it positive or is it negative? Neurodegeneration, is it positive, is it negative? Genetics. Genetics allows us to introduce a few other terms like familial factors or predisposition factors, because we know whether some genes cause disease or are just risk factors. So here it's not just positive or negative, we can even distinguish a bit further between the types of genetic alterations. And so this is the first version. This is also important to keep in mind. This is version 1.0 of the classification criteria. There's an alternative system that other colleagues have proposed that is based on the same idea of measuring synuclein and measuring neurodegeneration. In our current classification system, we propose this for research purposes. This is important to keep in mind. It's not something we think is ready to be deployed and to be used routinely in the clinic, because we still need to refine these biomarkers and to really understand if they can tell us something that we can measure consistently and that can be used then for the real world applications. But we're very excited that these tools exist today and they seem to be working well, and we need additional research to confirm that this works, and that then hopefully one day, even with some refinements, some improvements in the criteria, adding other types of information, we can really come up with something that clinicians will be able to use, much like what's already being done in the field of Alzheimer's disease, where colleagues have proposed a similar system even before we proposed ours in Parkinson's, and they are already revising their criteria based on these biomarkers. And so we think this is an exciting time, and we hope that this will have an impact in the design of clinical trials, and hopefully soon after that on the outcomes of the clinical trials.